Good evening, sir. I am studying Lyngdoh, second year medical student, and today I'm going to do some examination that is of the nose, mouth, and neck examination on you. So, is that okay with you, sir?
Yes.
So, with that, can I know your name and your age, please?
My name is Sanjay Steven Marwin. I am 21 years old.
Okay, thank you, sir. So, for easy reads, I have prepared the instrument here near me. So, with that, I'll be first sanitize my hand. So first I'll be inspecting the anterior and inferior surface of the nose, and with that I'll also check for any asymmetry or deformities. Okay. Okay. So I'll be testing for the nasal obstruction. Sir, can you please breathe in? Okay. Breathe in. Okay. So
Here, with the help of a pen light, I will gently press the tip of the patient's nose to get the partial view of the nasal vestibule. And next, with the help of an otoscope that is of the largest available ear speculum, I inspect the inside of the nares of the patient.
the color of the nasal mucosa is redder than the oral mucosa, which is normal, and also there is no swelling, bleeding, or exudate noted. Also, there is no deviation, inflammation, or perforation noted in the nasal septum. Okay, after using the speculum, you can either throw it or disinfect them appropriately.
Lastly, palpate for sinus tenderness. Press up on the frontal sinuses from under the bony brows, avoiding pressure on the eyes. Then press up on the maxillary sinuses.
Okay. Okay, so for the next examination is for the mouth. So, sir, are you wearing any dentures? No. Okay.
Begin the examination of the mouth by observing the color and moisture of the lip, and note any lumps, ulcer, cracking, or scaliness.
Okay, so there is no lumps, ulcer, cracking, or scaling noted. So, sir, can you please open your mouth wide for me, please? Okay.
With the help of a good light and a tongue blade, inspect the oral mucosa for colors, ulcers, white patches, and nodules.
So, the color of the oral mucosa is normal, that is reddish pink, and there is no ulcer noted. So, please open your mouth again.
In here, I am checking for the color of the gum, which is normally pink, and also inspecting the gum margin and the interdental papilla for swelling or ulceration.
Okay.
Next, I'm inspecting and palpating the teeth for looseness or if there is any missing, discolored, misshapen, or abnormally positioned.
Now, I'll be inspecting for the color and architecture of the hard palate. So, sir, can you please again open your mouth? Okay. So, sir, can you please say ah so that I can see the movement of the soft palate and uvula? Okay. I can see the soft palate rises symmetrically and the uvula stays in the midline, which is normal.
Next, I'm inspecting the anterior and posterior pillar, the tonsils, if there is any redness, exudate, or ulceration.
So, there is no redness, exudate, or ulceration noted. So, now I'll be inspecting for the tongue. So, can you please open? I see the tongue as the tongue of the patient rests on the floor of the mouth. I'll be checking for the symmetry. Sir, can you please stick out your tongue? Okay. So here I'll be checking for the symmetry and color of the tongue. Okay. Okay. The dorsal surface of the tongue. So, okay. Okay. So now I'll be checking for the undersurface of the tongue of the patient. For that, I'll be pulling the patient's tongue to the left or right. So can you please stop?
After this inspection, I noted that there is no white or reddened areas, nodules, or ulceration in this patient tongue.
Okay. So now we are done with the nose and the mouth examination. So the last examination that I'll be doing today is the neck examination. So with that, I'll be first inspecting the neck of the patient, noting of its symmetry, any masses or scars. Now I'll be also look for the enlargement of the parotid or submandibular gland, and I'll also check if there is any visible node. So, sir, now I'll be palpating the lymph node so that I'll note its size, shape, delimitation, and mobility, consistency, and if there is any tenderness. So, for this, I'll be filling the lymph. I'll be filling the lymph node. So, first I'll be filling is the pre-auricular, the posterior auricular, the occipital node, okay, the tonsillar, okay, the submandibular, superficial cervical, and the posterior cervical node.
Also here, I am palpating the posterior cervical chain along the trapezius and the sternocleidomastoid muscle.
So next is the examination for the trachea. So I'll be inspecting the trachea for any deviation. Okay. Okay, so it's good.
Next, tilt the patient head slightly back and with the help of the tangential light, direct it from the tip of the patient's chin and inspect the region below the cricoid cartilage to identify the contours of the gland.
Okay. I can see the lower shadow border of the thyroid gland.
Next, extend the head of the patient slightly back and give the patient a water to swallow.
Okay, so can you please sip this water? Wait, don't swallow it yet. Okay. Because I'll be observing the for the upward movement of the thyroid gland, noting its contour and symmetry of the yeah. So it's often butterfly shape. So sir, can you please swallow now? Okay, so that's good. So to confirm my visual observation, I'll be palpating the thyroid gland. First, I'll be locating the isthmus. Uh, okay, and then I'll be palpating the adjacent right lobes and left lobes of the gland as I stand in front of the patient. So also here I'll be looking for any goiter or enlargement of the lobes. So okay, which I did not hear anything. So which is
Standing behind the patient, I am placing my fingers of both hands on the patient's neck so that my index fingers are just below the cricoid cartilage of the patient. Next, ask the patient to sip and swallow water as before. Feel for the thyroid isthmus rising up under your finger parts.
so sir, can you please take a sip of water and swallow? Swallow. Okay. So while palpating this, I also note that the size, the shape, and the consistency of the thyroid gland is normal, and also there is no nodules or tenderness noted. So with that, I finish my neck examination. Thank you.